Well, we're glad you're here. We're glad you're supporting him and what he's doing there.
Of course.
And all of us, other than Anthony, I think, are constituents of Congressman Kilmer.
Oh, excellent.
There
Well,
may be other people joining in on the call because we just left another call that some are still on.
okay. Yeah, well, it's always great to be able to speak to more folks from the district. The district's also my hometown, so it's always great to be able to speak to more folks from the home district. It's great.
And so where do you live at? I'm in Tacoma.
Yeah, I'm also actually originally from Tacoma, Washington. I currently live in DC though.
Oh, yeah. You kind of have to.
Yeah, not much of a choice there.
Well, except this year it wouldn't have mattered much because so much is being done online.
That's
virtually.
very true. Yeah, I'm sure I could have vouched for that, but a tip for the next time, I suppose.
I didn't even get to speak in the last one.
Oh, no.
Well, that's crazy. You should have been able to, Ivanova, since it was a senator.
Well, you didn't stay for the whole thing because it's still going for 15 minutes.
It's still going, and so I had to leave. And so I was like, I tried to get Stacy's attention, but then she wasn't responding. And so I just said, never mind. I have to go anyway because I have to be at this one.
That's okay. You can still, I'm going to send out the email addresses for all the staff that we've been meeting with, and you can send in your comments or concerns via email.
Okay, fair enough.
Are you going to put that in chat or send it out to our email address?
I'll send it to email.
Oh, good.
Right, and I'm just sending a quick note to the representative scheduler really quickly. I know that he's been jumping and sort of running around back and forth, so I really do appreciate your patience, but hopefully he'll shortly. Thank you.
Used to have to run, like literally run quickly between buildings and offices, right? So now it's the opposite. Sit in the same place and just click into a different room.
Yep.
I feel like I live on Zoom. Like
today especially.
The funny thing is, because so much stuff is in Seattle, I actually get to attend a lot of things I couldn't attend if it wasn't COVID.
I think that might be this second diagnosis of Zoom fatigue.
Right. Well, he's definitely still planning on joining, but unfortunately, it looks like his meeting was running just a little bit over before this. So if it works for all of you, I'd love to be able to get started and listen to your priorities, and Derek can just jump in whenever he's in.
Sure. Well, I'm Diana Stadden, and I'm with the Arc of Washington State, the Advocacy and Policy Specialist. I also am mom to 3 kids, and my youngest is 28, and he's autistic. I know Congressman Kilmer from back when he was a senator in our state, worked on the Endangered Missing Persons Advisory and other things with him then. And I think this year, as far as congressional issues, there's 2 big ones that are really important right now. One is the Home and Community-Based Services Access Act. And that's a bill that Representative Dingell is working on. It doesn't have a bill number yet. She's soliciting comments right now. But it would do a number of things that would be very helpful. One of them is that our state has an institutional bias. And so the only entitlement you have to live someplace is in an institution. And if you waive your right to that institution, then you can get a home and community-based services waiver, except that there's no room on the waivers because they're not an entitlement. And so they're not funded. And we have like 15,000 people on our waiting list in Washington State who qualify for services, but don't get anything because they don't want the institutional entitlement. And there he is, the man of the day.
Hey, how are you?
Hi there. I'm good. How are you doing? Running from
I'm good. I'm sorry I'm a little bit late, but
That's
I'm
perfectly
pleased to
fine.
see you and eager to hear how I can be a good partner.
Thanks. Well, I was just talking about the HCBS Access Act that Representative Dingle is working on.
Okay.
Because we have almost 15,000 people here who qualify for services for developmental disabilities, but don't get anything because there's no funding. And in our state, the bias is you've got an entitlement to an institutional placement, but if you want community, you go sit on a wait list for years. We've had people on that wait list for up to 15 years before they can get any service. And it shouldn't be that way. We need that bias to be towards community services because all the Medicaid services are in the community, but they're not funded and they're not an entitlement. The HCBS Access Act would change that and get rid of that institutional bias. It could also help with portability. So if somebody wants to move to Washington State, right now we tell them don't do it. You'll be on a wait list for years. If they have services in another state, they don't want to leave. And same for here, people who are here who may retire or something, they move to another state, they lost their services here, they are not going to pick them up in the next state. And so portability is also an issue with that. And I can send that bill to your office so you can take a bigger look at it.
That'd be great. I know at least when we last looked, we were just trying to get more information about it. I am very sympathetic to and supportive of making sure people can access the care that they need. And as you point out, kind of the patchwork that exists currently where different states have different rules doesn't adequately serve people. So I hear you. I think you articulate a legit problem that needs to be solved, and eager to dive into the solution.
Good. The other one has to do with Social Security. The program hasn't been updated since 1984. The income limits that you can have on a lot of things have stayed the same all those years. It hasn't changed. There was a letter that was sent to President Biden that was signed by a number of congressional members about the Social Security problem and asking those specific points. And I can send that to your office as well. So that we can try and update the Social Security system because it's not working right anymore. It's keeping people below poverty. And if you want to try and get out of poverty, there's no way you can. It just keeps poor people more than poor, unfortunately. So if you could take a look at those two things, those are a big issue as far as I'm concerned. I don't want my son having to rely on an institutional placement. Right now he lives at home because there's no housing available in Washington State, particularly affordable, accessible housing for people with developmental disabilities. So if I'm gone, he's going to have a place to live. And that's not an easy situation, a solution here in Washington State. So I'm going to turn it over to some others for you to hear from too. You have a number of constituents here. Jeremy, would you like to go?
Absolutely. Representative Kilmer, hi. We spoke about a year ago at the beginning of the pandemic, but just to jog your memory, I'm the executive director of the Washington State Developmental Disabilities Council. And so we are one of the organizations that advocate on behalf of people with developmental disabilities and their families. And I also live in Tacoma with my family, so I'm a constituent. And I want to just emphasize one of the things that Diana brought up, just to put another point on it, the HCBS Access Act. It's hard to overstate the incredible importance and positive impact that that would have on people across the country. As Diana explained, we have potentially tens of thousands of people who may qualify for services but don't get them. And I think a lot of people get it and understand it, like yourself. And you know, some people maybe are not as familiar with the issue. So sometimes I'll use an analogy of a public school. It's sort of like saying, if you have a child with a disability, you can send them, they're guaranteed a spot in a segregated school. If you want to send them to school, they've got a guaranteed spot in the segregated school. But if they want an inclusive, integrated school, they're going to have to go on a wait list because they're not guaranteed that service. And that sounds ludicrous to us now because we have the IDEA and, you know, we're so used to inclusive education, but that is sort of the same level of ridiculous bias that we have in the home and community-based services setting. So I would just urge your support there. And if there's anything we can do to help you or any of your colleagues understand that issue, we're happy to do that. So
I really appreciate that. Yeah,
great.
I'm certainly notionally supportive. I just want us to take a look at the legislation, but I hear you loud and clear.
Great, thank you. So I'll hand it over to our wonderful advocates who have some stories to share.
So Ivanova, or there you are. So would you like to share, Ivanova?
Hi, I'm Ivanova Smith. Hi, Representative Kilmer. We met before in DC.
Ivanova is also one of the social media stars of the Kilmer team. So
yeah, so I'm glad to see you again.
You too.
And thank you for meeting with us today. And as a chair of SAIL, we are very passionate. We're really excited here in Washington. We actually just ended minimum wage completely. We passed a bill that will, in 2 years' time, completely end minimum wage and make it so that all workers with disabilities in Washington are paid equitably. And we want to make sure that that can happen in the whole country. And there's a bill, HR 2373 that would end the minimum wage federally, and we think it's important that this happens because it's important that people with disabilities are treated as equals in the workplace and anywhere else we are in the community. I also want to talk to you about things about infrastructure that now that the community has become more virtual with the COVID-19 pandemic, it's important that we have a technology infrastructure that allows people with disabilities to not be isolated and have access to the technology, to access their family and friends, to social lives and social events. And all those technical things are now on the computer. And so bandwidth and all that is really important. I definitely support the bills that were discussed earlier about housing and community supports. It's very important. We don't want to be in institutions. I was institutionalized for the first 5.5 years of my life, and I never want it to happen again. And I don't like to know that it's happening, that could happen to any of my friends and my peers. Nobody should be institutionalized just because of the support needs they have, and we want to shut them down. And so I'm very passionate about them. I'm also a member of the Shut Them Down Coalition, to say to the governor and even to the country, we don't waste money on these institutions. Put that money in the community and help people in the community. Thank you.
Thanks, Ivanova. And it's good to see you.
Molly, would you like to go?
Hi, my name is Molly Brooks. I'm a self-advocate. I'm autistic and I'm also mentally ill. I'd like to talk about an issue called Medicaid spend down.
Okay.
A Medicaid spend down is when you if you make above a certain amount, and in Washington state that amount is $794, which is one of the lowest in the countries. If you make above a certain amount, you have to make up that amount in medical bills before you can get Medicaid. So I have to pay, I'm a disabled adult child of a retired parent. So I get SSDI through that. So I make $1,000 a month. And this means that I have to pay $1,500 in medical bills every 6 months before I get Medicaid. And the problem with this is that services are tied to Medicaid. I can't get a caseworker or psychiatric rehab or any of those services until I hit my spend down. I recently almost lost my food stamps because I did not have a caseworker to help me with my paperwork. I have a very hard time with paperwork because of learning disabilities. When I lived in Pennsylvania, I did get these services and they were quite helpful to me. I had a caseworker and I had psychiatric rehab. My caseworker helped me find services, helped me with paperwork, psychiatric rehab. At one point I went to a program, and at another point I had people coming into my home to help me with things like organization, keeping track of my medications, which I have a very hard time with. And because of the spend down issue, I don't get these services, which has been pretty detrimental to my ability to function on my own. It causes me to need a lot more help from my parents who are rapidly aging.
Molly, how do we fix it?
Okay, here we go. There's two options. One is to raise the spend down amount, which is probably would be a faster way to deal with it. But the best option is to separate services from Medicaid so that people who work, people who make higher amounts on disability, are able to get services, because needing services doesn't mean that we can't work. I will always benefit from a caseworker, even if I was working a full-time job. So that's really the best option, is to separate services from Medicaid. Thank you.
I think that's really helpful, Molly. And appreciate you sharing your personal experience with me too. Thank you for that.
Thank you. You're welcome.
Thanks, Molly. And then Barb Poole is your other constituent here. Barb, do you want to unmute and share?
I did. Thank you, Derek, for being here. You know, all us folks in Special Olympics adore you. And
it's great to see you.
It's a great honor. I do have to say, you know, we have worked really long and hard with lots of things, and I feel I feel inspired and motivated that, you know, we're all headed to a better place and a better representation, and with a positive thought mindset that we can really bring and evoke and evolve wonderful things for all of our young adults with intellectual disabilities. And I'm looking forward to partnering at any level that we can. I apologize, I've been bouncing in and out. We have a parent that has been on a ventilator now for 4 weeks, and she has 2 IDD children, and they don't know the outcome, and it's been a very difficult battle. I'm not asking anyone to hold prayer, but I'm saying that, you know, COVID isn't over. COVID is so real.
Yes.
And the impact that it's having on our citizens and our parents and our young adults is just an incredibly difficult thing.
It's a deadly virus.
And I pray that everyone sees the importance of being vaccinated.
Yes.
I think it's going to make a huge difference.
I
do want to ask Derek if we could let Jennifer speak. She said she was very disappointed that she didn't get to share something with you the last time. And she has been rehearsing this because
I'm ready.
You're the powerful man that can hear it. Okay, Jennifer, that's your lead in.
Yeah.
Go, Jennifer.
U.S. Congressman Derek Kilmer, we know you care deeply about your people. I want to share a call to action that I've written. We said Black Lives Matter. We know all lives matter. We just need your help with Black Lives Matter. All lives are in danger in Washington. Stop the hate crime and discrimination and racism for blacks. Stop the hate discriminations for the LGBTQ. Stop the Asian hate crimes and stop the discriminations of all Special Olympic athletes in the USA. It needs to stop now. No more hate. We need to move forward together. Thank you, Congressman Kilmer. for all you are doing. Thank you.
Thank you, Jennifer.
Thanks, Jennifer.
You're welcome.
I want you to come to Congress and let some of my colleagues hear that too.
Yeah.
I do think that Jennifer and Robbie have enjoyed so much learning about advocacy that the two of them want to commit the next part of their lives to advocating. And
That's awesome.
I think they will be a key piece.
Hey, Mr. Derek, sir.
Yeah.
This is Robert.
Hey.
Move the screen towards you real quick, honey. Hurry.
I'm the IT guy, but yeah. Anyways, one thing is that I would like to get in or put onto the measure or something is the fact that there's like 10 states that already do this. The license, the IDs and everything. You would put a 9 in front, and then you'd put a code on the back. It would say insulin dependent.
Washington State licensing and IDs. You
Yeah.
had to introduce the whole.
Washington State licensing and IDs, it would have a 9 or something like that, and then on the back would have insulin dependent, autism, epilepsy, all that. So then whenever the police do come by,
They know.
they can pull it out and go, oh, okay, there's a code on it, 9, we flip it over. Oh, we see that, we understand what we're dealing with now.
Mm-hmm.
Instead of always resorting to the lesser of the violence.
Mm-hmm.
Sir.
Mm-hmm.
And we can certainly provide more information on that.
Thank you.
Robbie, on his own initiative, has been looking at that in all the states. And Robbie was a victim once of being very violently attacked by the police because the police didn't understand that he was just trying to protect me. And he feels if the police know that our kids have disabilities or have a medical condition, as soon as they see their ID, that it will be huge at how all our citizens can be respected and treated, you know.
Yes.
I appreciate that.
Yeah.
And we're certainly, and the House has passed a bill that's focused kind of broadly on policing, on trying to raise standards and improve training and make sure that everybody gets treated with respect and with dignity. So I really appreciate your point. I don't want to miss the fact I saw Ivanova's point in the chat about, maybe she left. Did she leave? Can someone tell her? So there's a bill. Oh, there you are. Sorry, I lost you for a second. The marriage penalty bill has been reintroduced, and we will get back on as a sponsor. I was a sponsor in the last Congress, and we'll get back on it.
That would be great.
Thank you so much.
That would truly be wonderful because we all value true traditional relationships, and that will certainly encourage our athletes and young adults with disabilities.
And if you ever need somebody to do photography, Mr. Sir, let me know. I'll be more than happy just to swing by and do whatever you need done.
I really appreciate that. Well, speaking of photography, I want to make sure we get a screenshot so we can shout out you on social media and shout out your great advocacy if you're up for that. Is that okay?
Yes, I already took one, but you guys can take.
All right, Leah,
too.
you want to do the honors?
Yep. All right. I'll go ahead and take this screenshot in 3, 2, 1, smile. Great. I got it.
So Derek, I just want to call your attention to part of what I know was talking about. We have HR 761. So is there a Senate bill also that is coming to companion that? For the marriage access bill?
I was speaking into a muted computer. Yeah, HR said that there is a House bill. We'll get on the House bill.
Okay.
I don't know if there's a Senate. I'm trying to see if there's a Senate bill
I
companion.
didn't see one.
Yeah, I don't think there is one.
Well, one of the other bills that does have a Senate bill is 515, and it's HR 1368, both of them. It's the Mental Health Justice Act of 2021. And it's part of what Barb was talking about, that if a person has a developmental disability or mental health issues, instead of sending police, which too often ends up with a real sad end to it, that they would send certified counselors to help, de-escalate situations that include people with developmental disabilities or with mental health issues, instead of having these shootings one after another that didn't need to happen when they were just, misunderstood people, because law enforcement they're not trained on everything. They can't be.
We definitely hear that, and so sorry. I'm more than happy to stay on, but Derek, I know that you've got to run to your next meeting. But
Oh, you're right.
Stay on and speak to you all about anything else you want to chat about.
We'll take a look at that bill. I'm certainly, and frankly, we often hear from law enforcement that they don't feel like they're the right folks to respond in all of these cases. So making sure that we have the appropriate responders, I think, is really important. So we'll check out that bill too. I'm sorry I'm overbooked today, but I really appreciate that I got to spend some time with you. I'll leave you in Leah's capable hands from here, but very much appreciate your advocacy, and please count us on the home team.
Thank you, Derek.
Thank you.
Thank you.
Thank you.
To Wikipedia, Derek Michael Chauvin.
And I know that Derek had to run, but again, I'm more than happy to chat about any additional priorities that you'd like to chat about. I think we've got a good amount of homework here to be able to make sure that we're checking out all the bills that you guys are supporting. But I'm happy to hear out anything else that you guys would like to discuss.
Well, I have a couple other ones. HR 1234 would end corporal punishment in schools. And it's an issue that is a big problem here in Washington State, is restraints for kids with developmental disabilities in schools. I mean, we've had some really terrible outcomes, and that we know that positive behavior supports work, but so many schools just rely on the restraints and seclusions, and it shouldn't be that way. So we'd like to have you look into that bill. HR 1235, in our state here a couple years ago, we passed a law that you can't discriminate against a person with a developmental disability if they need an organ transplant, because too often they were put at the end of the list because they thought, well, they're going to die early anyway, we don't want to give something to them. They can't do that in Washington State, and 1235 in the House up there would make it federal so that they can't discriminate against people with DD. The ABLE Act, which has been really good for our state and others, needs an age adjustment to it that they found. And so S331, and then there's a companion 1219 in the House, would adjust that age limit. And Anthony can share a little bit about how this works, but S1099 is to amend the Social Security Act, and it's so that people who are on Medicaid, they don't have to go into impoverishment because they get married and suddenly Social Security says, oh, we're going to cut you in half because you're married now. Anthony, I don't know if he's listening. Anthony, and there we go.
Hey.
Anthony, I was just talking about the Bill 1099 about not having spousal impoverishment if you're on Social Security and you get married. Do you want to talk about your problem with that?
Yeah, my name's Anthony. I've been married for almost 2 years by next month. And it's we had to fight Social Security to basically prove we're disabled. And you can't put a price tag on love. I mean, because marriage is about love, and Social Security should not be penalizing us for wanting to get married legally. We all deserve to be happy. We all deserve to do everything. And that's the same with, the sub-minimum wage is sub-minimum wage. They're putting us in poverty, and with Social Security as well. If we want to get a job, there should be a way to put, say, if we're making the amount, not terminating us off the program, but instead putting us on a hold, kind of like, freezing the assets for our eligibility. And then if we did not have a job, we have something to fall back on, because now that Washington State has terminated sub-minimum wage, employers will say, well, sorry, you can't work for us anymore because we can't pay you that wage anymore. We have to subject to full wage, and we all deserve to live independently and everything. And that also goes on working on the ABLE Act, improving the National ABLE Act, because yes, they say it's supposed to help protect all benefits, but for right now, it's protecting Social Security benefits from losing them, but it's not protecting Section 8 housing, and it's not protecting food stamps, because someone can live in a house or an apartment that's over $1,000, and they have other bills, or they live in a cheap place and have a lot of bills and food and family to provide for. So it's like we need to see about, and also the age limit from 26, definitely there's been talk about having it go up to 46. That definitely needs to go through, so that people with IDD, or if someone becomes disabled because of an accident, they are eligible. And then it's like if they got one after 26, they're like, well, I'm not eligible. I have nothing to help me and stuff. And plus, I'm a real big believer with diversity. It's like, I don't know, I have all kinds of ways to say it. I'll just say it bluntly, as people of all color with disabilities deserve to be treated the same. They need to be treated with the equal support. And plus, we're trying to shut down institutions because, yeah, a lot of agencies are afraid of losing their jobs. But I believe in not just money follow the person, but also services, like those people's jobs that go with those individuals follow the person too. Then they keep their jobs that apply to those individuals who need those services, and have communities instead of, I call them prisons, because that's what an institution to me is a prison. Thank you.
Thanks, Anthony. Kristen, did you have anything you want to share?
Hi. Thank you for being here and repping Derek Kilmer's office. My name is Kristen Knutson, and I'm a registered nurse. I work in the home and community. I go into a person's home who has disabilities and complex medical conditions, and stay with them from anywhere between 4 and 16 hours a day. So I work in home, and this new Home and Community-Based Services Access Act, I hope Congressman Kilmer signs on to it when it gets a bill number. I'm looking forward to this because me and the nurses and the direct service professional, the direct service providers, all of us that provide direct care, we have some infrastructure, and you know what? There are so many great people that are ready and able to help build this infrastructure. And I think the Access Act can help us build more, hopefully. So I just encourage that, and thank you again for all you do.
And I think, let's see, Sean, did you want to share anything?
To help the money follows the person through. Hello, Leah. My name is Sean Latham, and I'm the director of the Washington State Self-Advocacy Organization, Allies in Advocacy. I, like many of our members and partners, rely on home and community-based services to stay active in the community. In particular, I use in-home care services through the Medicaid buy-in Healthcare for Workers with Disabilities program. Many others access those same services through traditional Medicaid. These services have kept me out of costly segregated facilities and hospitals, since I'm able to get all my health needs met, as well as being able to access all aspects of my community. Many others use home and community-based services, or services around transportation and home health, to name a few. So I ask you, Congressman Kilmer, to support efforts to improve home and community-based services through the proposed $400 billion investment in the program. I would also encourage Congressman Kilmer to help the money follows the person program become permanent, so that people can transition into home settings easier. And finally, it's important to make sure we get rid of the institutional bias. We need to make home and community-based services the default way to serve people with disabilities, instead of costly and often deadly, congregate institutional settings. So I would greatly encourage Congressman Kilmer to support the soon-to-be introduced Home and Community-Based Service Access Act that would make these services an entitlement. Thank you for listening to me and for your time.
Thank you so much for that.
Sorry. Go ahead, Leah.
Oh no, I really just wanted to say thank you so much, Sean, Kristen, and Anthony, for what you just said. We're definitely happy to take a look at the Home and Community-Based Services Access Act once it's introduced, but Representative Kilmer certainly shares in those goals. Anthony, I'm happy to let you know that Representative Kilmer has signed on as a co-sponsor of the ABLE Act, but we really do hear your concerns about the other legislation that you've raised as well, and we're more than happy to take a look.
Thank you. That's really good. I bet that'll make a lot of our other residents here in the state who are not here with us happy.
Yeah. Well, and I know we're out of time, Leah. We've kind of run over, but we really appreciate you as well as Congressman Kilmer for taking the time to meet with us. And if there's anything that we can do to help with any legislation that he's working on and he needs advocates to speak up, just let us know and we'll be there.
Absolutely. Well, thank you all so much. It was really nice to meet you. And I know that Representative Kilmer had to leave a little early, but he was really excited to see you all as well. So, please do stay in touch with us. And if there's anything else that we could do to be of assistance and be a good partner to you all, I'm an email away.
I will send you some information to follow up on the HCBS Access Act and the SSI letter to Senator or President Biden. Thank you.
All right. Thank you all so much again.
Thank you.
Bye.
Thank you.